Hi, I'm Dr. Pagnani with Rittenhouse Psychiatrist Associates. We serve Pennsylvania, New York, New Jersey, Delaware, Florida, and a few other states for outpatient mental health treatment in office and virtual. So let's talk about 5 red flags to look out for when choosing a psychiatrist, psychologist, or other mental health professional. The 5th is actually, in my mind, probably the most important of all 5. Number 1, if your provider talks quite a bit about themselves, or if your sessions feel like they're just chit-chatting with you, that's a huge problem. Your provider needs to be focused on you for your sessions. The purpose of you meeting with your psychiatrist or your psychologist is to discuss your specific problems, for them to evaluate your condition and how you're doing, and for them to be focused on your treatment to help you with your symptoms. They shouldn't be sitting there talking about where they vacation, their families, or what their favorite sports team is. Number 2, if a provider has casual phone appointments with you without seeing you face to face in the office or by virtual visits on Zoom or a telemedicine HIPAA compliant platform, that is also a huge red flag. It's the standard of care that your provider can see you for your appointments, especially if they're prescribing a medication. Medications have side effects. Those side effects can be severe. Patients may have symptoms like withdrawal or other issues, or even psychosis for some individuals that you really can't notice unless you can see a patient. So again, virtual visits by video or in-office visits are fine. But if your visits are all phone calls, you might want to find a new provider. Number 3, if your provider tends to write all of their patients or most of their patients for the same medications at the same doses, then you really should question whether they're looking out for your best interest. There are a lot of online national telemedicine companies that focus on 1 or 2 conditions. And when we hear from patients who use these companies in the past and then switch to us, they'll say things like, oh, they prescribe pretty much everyone they see 30 milligrams of Adderall twice a day, or Xanax a milligram 2 times a day, or this or that at these doses. Those medications are highly addictive. And if a provider is writing everyone for the same medication at the same dose, there's a serious problem. Psychiatry, just like medicine, is an art. It's complex. You need to evaluate patients, thoroughly understand their condition, and then discuss the barrage of treatments available and sort out the best treatment for that individual patient, not for the masses. Number 4, if a provider doesn't screen for substance use disorder history, or for bipolar disorder, especially if they're prescribing you an antidepressant, you may want to think twice about using that provider. Controlled medications are very dangerous to use, especially if someone has a history of a substance use disorder, and it needs to be discussed and monitored by your prescribing provider. And about 1.7% of the population has bipolar disorder. It's not all that uncommon that you don't realize or find out that someone has bipolar disorder until you put them on an antidepressant. So the provider needs to explain to patients what symptoms to look out for, especially if they're going to be using an antidepressant, to make sure that you're safe with that type of treatment. And number 5, which I think really is the most important because it's just an obvious red flag, if you sit down with your provider and before they do an extensive history and before they discuss the different options of medications and why you may choose one versus another for your specific condition, and they just ask, what do you want or what are you looking for in terms of medications? I would think about running away from that provider. Providers need to take the time to really understand your specific condition, and if they're acting just as a pill pusher or as a drug dealer where you can come in, you can tell them what you want and they'll write you for it, they're really not acting in your best interest or the public's best interest at large.